We're about halfway through annual enrollment period, AEP. So that's the period where you get a lot of spam mail, spam calls, spam texts, but it is a time where you actually do need to pay attention to the upcoming changes. This is being filmed in 2024, so I'm talking about those 2025 changes. So I'm going to go through 3 quick things that's just going to help you out a little bit during this annual enrollment period and get you ready for 2025. Let's get into it. All right, so if you're new to the channel, I'm an independent agent. I'm a broker. I like to do these educational videos because, well, I'm in here in Texas, but there's Medicare age people all over the United States. So I'm here to help. This video is about annual enrollment period. So I'll go ahead and pull up the slide now. Now, during this period, here are the things that you can do. But the first thing that you should do is that this video is for everyone. So whether you're on Medicare Advantage plan or you've got original Medicare with a Medicare Supplement and a drug plan, there is one thing that has been mailed out to you. It has, like, since mid-September or late September. It's there. Check your latest stack of mail. It's probably there, or it's probably something you just set aside. What am I talking about? It's called an annual notice of change. Now, an annual notice of change is a letter from your insurance company, whether it be the Advantage Plan company or the prescription drug plan company, and it's telling you what the changes are in 2025. You need to read this. Don't just call your agent. Well, we're here for that, right? We're here to service you and say, or, you should look out for this, you should look out for that. But take some initiative. It goes a long ways, especially when you do need to know your plan and use your plan. You know your plan. That was my point. So take some initiative and get to know the changes, and then call your agent and say, okay, I saw that the inpatient hospital is now extended another day. Is there anything less? I'm not sure I can do that. What do I do? And so, anyways, that's what we're there for, is specific pointed questions. Please take it upon yourself to read your annual notice of change. Okay, now this is what you can do and what you can't do. Most of it is what you can do in the annual enrollment period. You can think of annual enrollment period like back when you worked, you had an open enrollment period to make all those changes for the upcoming year. So same thing here. If you have a Medicare Advantage plan, you may switch from one Medicare Advantage plan to another Medicare Advantage plan. Just make sure, or just understand that this change will only go into effect 1/1/2025. Now, if you received an involuntary disenrollment letter, a lot of my clients, especially here in Texas, have received this letter from Humana. Humana pulled out one of their most popular plans. I don't know why they did it, but they received an involuntary disenrollment letter. That means that the plan is just discontinuing in 2025. So they must pick a new plan. Some plans may be leaving your area. Therefore, selecting another plan is required if you want to continue to have coverage. There are some carriers that will just put you, it's called, I think it's called walking you to another plan, walked across an, I don't know, basically they put you in a very similar plan. There's some companies that do that, but then some companies that pretty much say your coverage is ending in 2024. You should pick a new plan. So if this is the case, you can pick another Advantage plan, or you can actually apply for a Medicare Supplement in 2 different ways. Now, this is if you are involuntary disenrolled or not. You could be somebody who picked an Advantage plan and you're not happy with it, and you should have listened to, your aunt, your uncle, your neighbor that said, "Oh, I got original Medicare. You should do original Medicare." Maybe you didn't want to pay the premium, but now you're more than happy to pay the premium. So this means if you qualify, you can get into a Medicare supplement, you'll just have to go through underwriting. So they do a script check, they do a medical background check, like they check your diagnosis and events that have happened to you. Some are have you ever questions. Have you ever been, diagnosed with blah, blah, blah? Or in the past 2 years, have you been diagnosed with blah, blah, blah? So you can enroll in a Medicare supplement plan. You'll need to qualify for it. And then that effective date would be January 1, 2025. And just remember to also pick out a drug plan to start January 1, 2025. Now, there is a special election period for those who were involuntary disenrolled. It was not their fault that their plan changed. So it creates a guaranteed issue period into a Medicare supplement. So this is for those, this is a opportunity for the taking. If you're somebody who's been involuntary disenrolled and you said, you know what, I'm going to use this opportunity to get into a Medicare supplement plan, there are no questions asked. This is a great opportunity. If you missed it when you first started your Part B and maybe some health issues have arisen, and now you've been wrestling with your Advantage plan, and you said, gosh, if I could do it again, I would do a Medicare supplement, and the golden goose egg is just showed up at your door, and you're like, oh, here's an opportunity. That is an opportunity to start a Medicare supplement guaranteed issue. That means no questions asked, starting January 1. If this part is a little confusing, I completely understand. Just drop a comment or message me. I'm on Facebook as well, and I'll be happy to answer your question. My contact information is also in the description below. Okay, and lastly, you can do nothing. Uh, but by doing nothing, that means you can't complain. If there's something that, gosh, last year I paid, only $20 for my specialist, and now I pay $55. I'm complaining. You don't get the right to, because you did nothing. So at the very least, review your annual notice of change. Okay, now if you have a Medicare supplement, you can. If there was a bigger font that I could use here, I would, because this is the most overlooked thing if you are on a Medicare supplement. You don't have to wait till annual enrollment period to shop your Medicare supplement rate. You can do that at any one of the 12 months ahead of you. I'm saying you can do it at any time. Now, it is subject to underwriting during annual enrollment period or outside of annual enrollment period. More than likely, you have been on your Medicare supplement for a while. Then all of a sudden, these couple, last rate increases, they're not nice. And now, you started at $115 a month back when you started your Medicare supplement, and maybe you're at 180, and you're like, okay, this is noticeably getting uncomfortable. I feel like I can answer some yes and no questions and come out with a pretty favorable decision, meaning you think you can be approved, meaning you think you're a bit healthy, so you can answer those yes and no underwriting questions. Why not go from F to G? Remember, the only difference between F to G is a Part B deductible, which in 2024 is $240 annually. That's not bad. Do the math on your Plan F premiums versus a Plan G premium. And if you need help doing the math on these and finding different companies, different quotes, different rates, shopping around, again, my link is in the description below, or contact your agent. This is something you just got to do nowadays. We've got a new president, whether you like him or not. The economy's bound to do something, but everybody is now paying closer attention. This is something that can save you some money annually, especially over time. So moving from F to G, you just have a Part B deductible. It doesn't decrease your quality of coverage. Okay, moving G to G. G to G, there's sometimes $10, $15, $30 differences between companies. Or moving from G to N. Don't freak out on me. N, there's two copays. There's a doctor's copay of $20 and an ER copay of $50. If you feel like you can handle those and you're not a frequent flyer to the doctor or the hospital, you could save quite a bit on insurance premiums. And yes, before you crucify me, yes, there is a difference between G and N does not cover excess charges, but excess charges happen 3% of the time, 4% of the time. You're statistically not going to run into that. And not to mention, it's pretty preventable by asking your doctor, do you accept Medicare assignment? I would straight up make sure. So at any time, you are not going to charge me in excess for the service that I'm about to get. Like, get detailed with the little front desk lady before you get a service. But N is a great, it's my favorite Medicare supplement, 100%. If when I get on Medicare, I'll be choosing plan N. Okay. If you have a Medicare supplement during annual enrollment period, you can switch to a Medicare Advantage plan. So let's just say you've had it with Medicare or with insurance premiums. And here are the things you must understand going from a supplement to an Advantage plan. Because this is like, you know, apples and oranges. It's not like you're moving like to like, apple to apple, like F to G or G to N. By moving to a Medicare Advantage plan, you understand that the insurance company is going to be in your business a little bit more, meaning they're going to have a say so in the kind of treatment that you get. They're going to, not that you get, but that they say, well, what you want is maybe treatment number 3, but you haven't even tried treatment number 1 or 2, so we're not going to pay for this one quite yet. Okay, they can do that. They can also, if you know, these are it's managed care, so these are broken up into HMOs or PPOs. So an HMO, you need a referral. PPO, you don't need a referral. You can go in and out of network, but understand, you coming from a Medicare supplement, so you coming from your primary insurance being original Medicare, is no networks, is 96% of the doctors saying, come on in, we take your insurance. You're now going to a PPO, which I don't know what the latest statistic is, but it's definitely not 96% of doctors. So you better make sure with your agent or with the whatever plan's website, you're looking at who's around you. Primary care wise, specialist wise, hospital wise, you're making sure that you're not going to get turned away. No one's going to turn you away during a life-threatening emergency. But statistically speaking, that happens not a lot of the time. What happens a lot of the time is maintenance, is seeing your endocrinologist, your cardiologist, okay, your primary care. So you want to make sure doctors are going to be in your network. You also understand that if the wheels fall off on a Medicare Advantage plan, the national average, I would say that I'm seeing in 2025, a max out of pocket is, close to 7,000 with a PPO, which I recommend over an HMO. If the wheels fall off, completely fall off, you will pay more in your max out of pocket, right? $7,000 versus the insurance premiums on a Medicare supplement. Remember, especially if you're with a G, after that 240, your medical services are covered by paying the monthly premium. So you can rack up a lot of copay dollars on the Medicare Advantage side. Okay. So going from a supplement to an Advantage plan. Now there's some advantages. Yes, you get the dental, you get the vision, but take a look at that. The insurance carriers are seeing that while people want 4,000 in dental, they don't even go to get their annual exam or their 2 cleanings a year. So why pay for the benefit? So those benefits have decreased over time. So just make sure that it makes sense on multiple fronts to switch to an Advantage plan. Because if you switch to an Advantage plan, you may not always make it back into your Medicare supplement plan. I'm not saying that it's impossible, but again, statistically speaking, you may not. Because as you get older, you need more pit stops, so so to speak. Okay, if you have a Medicare supplement, you must review your drug plan. You don't need to necessarily review your Medicare supplement. However, your drug plan needs to be reviewed. If you've changed your prescriptions, review your plan, but also your your drug plan provider has changed on you. That means that the formularies have changed. So the formularies are lists. Imagine like 5 sheets of paper in front of you laid out from left to right. And there's just lists of prescriptions on each of those, from generic, maintenance, a lisinopril, losartan, a statin, to all the way to like Eliquis and high tiered, maybe even chemo medication. Okay. From left to right, least expensive to most expensive, those prescriptions have shuffled, and they shuffle between companies too. So I ran into somebody whose medication was on a tier 2 with one company, but a tier 4 with another company. So guess where we went? We had to shop it, but we would have never known that unless she would have said, hey, yes, please do an annual review. So please ask your agent to do an annual review with you, even if nothing's changed with you necessarily. But remember, your insurance can change on you the upcoming year. So review all plans. That's it for today's video. Like I said, you're about halfway through annual enrollment period. We're almost there. We're almost done. Take the time to review if you have not. My description in the description below, there is a link to get a hold of me if you need some help. See you in the next video.